Hello, in this PowerPoint, we'll talk about deontology. I mentioned in the previous PowerPoint that this is the rights and duties approach to ethics. This was certainly championed by Immanuel Kant in the 18th century. It is one that argues that the rightness or goodness should be examined from the rules and duties for the person who did it. This is focused very much on the individual's right to do things, which usually imposes a countervailing sort of duty. And one might be thinking about the Bill of Rights to the U.S. Constitution when one thinks about this sort of a school of thought. It is very much focused on human autonomy, the right to make one's own decisions and to live freely in making those decisions, i.e. We should have the right to choose how we're going to be treated as a patient. Sound familiar to anyone? The flip side of this, of course, is that if one has rights, those rights have to be protected, which usually imposes a burden upon someone. Patients, for example, under this school of thought, have a right to the truth. Kant would argue that it is an absolute duty to tell the truth by healthcare providers or by anyone else. That certainly has been criticized. That there is a right to privacy, and after you have read Roe versus Wade, hopefully this will have kind of a ring of familiarity to you. There's a right not to be injured. Again, this might sound a little familiar from the Hippocratic Oath that you've reviewed. And there's a right to get what you've agreed to, i.e. an informed consent, an agreement as to what procedure is going to be performed and that procedure actually be performed. Excuse me. The way one tests whether something is moral or immoral is based upon the rights of those who are involved in the situation. How do you determine what is the ethical action? It is that one that best protects and respects the moral rights of those affected. Now, that may be somewhat easy in a binary sort of situation of there's a patient and a doctor, and you look at only those two and making that decision. But as you can imagine, most decisions are much more complex than that. It may be difficult to agree as to which rights we have. That list of moral rights is often widely debated. It may vary upon what culture you grow up in. The right to freedom of the press, for example, is a somewhat unique sort of right in France, even in Great Britain. Much more strict laws as to what that right of free speech is. Some would argue that, in fact, it's much broader than human beings, that those rights would extend to any sentient sort of animal, whether that's a cat, a dog, a cow, a whale, and so on. As I mentioned before, of course, if one has a right, then probably somebody else has a duty, and that is where often the arguments about rights kind of breaks down is, well, if there may be that right, but how do you protect or how do you enforce all of those duties, or how do you require those duties of everyone else in the process? Challenge also of this is that not everyone's moral compass is quite set exactly to the same North Pole. Kant would say that there's a categorical sort of imperative here that we all kind of know what is right and what is wrong, and how we ought to be living autonomously. This is another way of phrasing what is the correct answer, or how one determines how the decision should be made. This life, liberty, health, dignity, and choice. The founding fathers did a little knockoff on that and shortened it up a little bit, because that certainly doesn't have quite the ring of life, liberty, and the pursuit of happiness. But it kind of gets us all to the same sort of place. One would also be could have an interesting argument about what health means um, in our society. Is that a right to health? Is that a right to access to health care, or is that a right to actually receive health care in all situations? The criticism of the deontology is that there's generally a conflict of factors when one tries to apply these things. For example, this absolute duty to tell the truth to the patient, to everyone else, conflicts with the idea of the duty of confidentiality to a patient, for example. Um, there are lots of other times that this absolute bright line application of autonomy really goes too far. The patient may have or an individual may have a right to free speech, but can they yell fire in a crowded theater? So one has to balance all of these rights and duties um, as one looks at these decisions. We also quite often see that the implication of morality, whether it's deontology or others, is that by invoking it, we may be actually seeing someone selfishly trying to gain advantage in a situation. And conversely, if we protect rights over aggressively, it may exaggerate the entitlement of certain folks in a subgroup that at the expense of other folks. If, for example, should the citizens of a racial minority have more rights than those of the majority? For for example, South Africa, the white minority certainly enjoyed a number of rights that the majority of the citizens did not. We've touched upon this briefly previously, that how one limits their rights may be hard to establish. If one has a right to health, should a terminally ill person be kept alive at all costs, even though that may have a social price to everyone else in the society. The other criticism is who determines who has what individual rights. That may vary between cultures, may vary between religions. One has to kind of sort out before you get into this debate as to what is the society's goals and what the ethical priorities are in looking at these rights. That brings us to the end of our conversation about deontology. In looking at the Bill of Rights, you probably saw a lot of allusion to deontology. It was certainly popular in the late 1700s when Jefferson and Madison were thinking about these things. And it is an intriguing aspect that we'll talk about more when we talk about principalism. And it is certainly very popular still in the U.S. And very popular in the concepts of patient care. So keep it in mind as we go forward.